Let's go over one more type of blister, and that's a blister where the roof has become very loose and is not intact. Now, if it's a small tear, remember we're going to manage it either this way or this way. So you're going to express the fluid and either put isolating donut dressing on or one of these Spenco blister pads. If it has gotten to this point where it's big and you've got floppy skin, the best thing to do is going to be to gently debride that skin, and you can use your razor blade or a pair of scissors, and you just basically lift the skin up and try and get as close to the edges of the blister as possible. Just like that. So we're just cutting that skin away gently. That's going to be kind of irritating and painful without a doubt. But now we've got the roof removed, and this now is a very raw blister base. How do you take care of that? You can apply one of these Spenco dressings, or you can apply one of these isolating donuts that we talked about. But this is a case where you'd want to consider taking out of your first aid kit perhaps a little bit of antibiotic ointment and put that on there. Now, if you're going with what's in this kit, there's no antibiotic ointment, but you can use these after cut and scrapes medicated pads. They're both antiseptic and anesthetic. So they'll certainly be useful for a anesthetic point of view, but also more importantly, the anesthetic part will cut down the burning and stinging. All right, so that kind of goes over just basic management of blisters. And of course, there are lots of little tricks, and I'm sure we're going to hear about those in comments, and it'll be nice to share those with everybody. But this will give you the basic information and material to take care of blisters out in the field. And let me just say this, what you want to do now is to keep an eye on these for potential infection. Most blisters with good management like this are not going to get infected. You want to change the dressing at least daily, or certainly more frequently if it becomes wet, soiled, or wrinkled. You want to seek medical attention if you do develop signs of significant infection. That would include pus formation, some red surrounding skin, or red streaks spreading out from the blister. That I would recommend as soon as possible should be evaluated by trained medical personnel. You might need to be started on antibiotics. All right, guys. Hope that helps, and again, I appreciate everybody watching. I appreciate all the comments, support, and subscriptions, and certainly the ratings. Thanks, guys.